So I think what this illustrates is that indeed these lipids, changes in the lipids that we observe in many different tumors, do carry a lot of information of the cancer cells of the tumors. And so we wondered whether these lipids and this lipidomics approach can be used for biomarker development towards cancer diagnostics. So we're using our same platform here, our phospholipidomics platform. In this case, not only starting from tumor tissue, but also from urine and plasma. Because if we want to develop a biomarker that will be used in the clinic, I think it is useful to not always, that we not always need to have access to the tumor itself. Because that can be used only in cases when we have surgical resection, when the tumor tissue is removed, or we have to take biopsies, which is quite invasive. So it would be a lot better if we could do the analysis on body fluids, such as urine and plasma, which is a lot less invasive. So that's actually what we're doing. We're analyzing tumor tissue, urine, plasma, using our mass spectrometry-based lipidomics approach. And typically we're analyzing a lot of different patients. You cannot develop a biomarker based on 10 patients, so there's a really huge sets of patients that we're currently analyzing, different tumor types. What we typically do then is perform some kind of biostatistics, usually based on principal component analysis and multivariate analysis and so on, to try to find changes in lipid profiles that can tell us something about the clinical status of the patient. So we will link the clinical data with the lipid profiles and try to find lipid signatures. So specific changes in individual lipids, and usually in a combination of lipids, what we call lipid signatures, that can tell us something about the clinical status of the patient. So they can tell us how a patient responds to therapy, for instance. And that's exactly what we're doing in our lab. This is an example of lung cancer tissues in this case. We have analyzed hundreds of lipid species in a few hundred patients with lung tumors and identified lipid species that can almost perfectly discriminate tumor tissue from cancer tissue. As you see, for instance, here, the blue are the normal tissues and the red are the cancer tissues. So based on changes in lipid profiles, in this case a combination of sphingomyelins and phosphatidylserines, we can distinguish really these two groups, normal tissue and cancer tissue. And that's nice in terms of biomarker development. Just looking at lipids, we can distinguish cancer from normal. We and several other people are going a step beyond and not only looking at tissue, as I said, but also looking at the level of plasma, because for biomarker development you want to have an assay that's as least invasive as possible. And this is work that has been done by Zhao et al. They have looked at lipid profiles. They have analyzed 390 different phospholipid species in the plasma of prostate cancer patients and of normal volunteers. And they have found a number of lipids, in this case 50, a combination of 15 phospholipids that they developed as a lipid signature. So you can pretty well distinguish in red the controls from the patients. Just starting from plasma. We don't even have to look at the cancer tissue itself. We can see this in the plasma. So we take plasma, analyze the phospholipids, and based on a specific lipid profile in the lipid signature, in this case a combination of 15 different phospholipids, we can really distinguish cancer patients from normal volunteers, which is quite nice.